Hello, my name's Claire. If you're watching this, you've accepted the important duty of caring for someone who may have prolonged epileptic seizures. Prolonged seizures can look, feel and sound different in different people. You may find this a little daunting at first, but don't worry. By the end of this DVD, you will know exactly what to do when the person you're caring for has a seizure and how you can prevent that seizure from progressing. A seizure can happen at any time and is rarely triggered by flashing lights. If someone has a seizure, remove loose items such as glasses or any item that may cause harm during the seizure. Next, make sure they are safe by moving any harmful objects from nearby. Only move the person if they are in a dangerous situation such as by the side of the road, near open water or hot cooking appliances. Don't try to put the person onto the floor. If it is a tonic-clonic seizure, they will probably have fallen to the floor before you have noticed the seizure. If the person is in a chair, leave them there but gently turn their head to one side. The medical team looking after the person with epilepsy will have put together an individual care plan. You need to be familiar with this. This individual care plan will tell you when to give the rescue medication Epistatus and exactly how much is right for the person you are caring for. They will have been prescribed Epistatus by their doctor to help stop the prolonged seizure. If possible, find someone to look after the person with epilepsy while you prepare to administer the Epistatus. Time the seizure while the helper is getting the Epistatus and care plan. If the liquid is cloudy or contains crystals, do not use it and call for an ambulance. If the bottle of Epistatus has expired, do not use it and call an ambulance. If all looks correct, unscrew the child-resistant cap, keeping the bottle upright. Insert the oral applicator into the centre of the bung in the neck of the bottle. Turn the bottle upside down. Pull the plunger back completely and push back to release any air bubbles. Pull the plunger back again slowly and draw up the prescribed amount of liquid according to the care plan. Turn the bottle the right way up before removing the oral applicator. Put the cap back on to stop spillage or evaporation. When a person is having a prolonged seizure, their teeth are usually clamped shut. This provides the perfect position to give the Epistatus. The area between the gums of the lower jaw and the cheek is called the buccal cavity, and this is where you place the oral applicator with the prescribed amount of liquid. If the person's movements are difficult to control, ask someone to hold the patient's head gently in order to keep it as still as possible. Gripping the head too firmly while the body is shaking can harm the spine, so it is important to use minimal restraint. Push the plunger of the oral applicator slowly. Ideally, about half the liquid should be put into one buccal cavity. It is not necessary to put exactly half of the liquid, just estimate it as best you can. Then put the rest of the liquid into the buccal cavity on the other side of the mouth as before. If the patient is difficult to control, place all the liquid slowly into one buccal cavity. This should take about 4 to 5 seconds. Placing all the liquid in one buccal cavity will increase the time to stop the seizure, but only by a minute or so. Wait for 5 minutes for the Epistatus to work and for the seizure to become less active. Check that the person is breathing well. After 10 minutes, the person should be making a recovery and the seizure stopping. Their breathing and colour should start to return to normal. If their breathing remains irregular or shallow, or if the seizure fails to stop, phone for an ambulance. Once the seizure has stopped, put the person into the recovery position and allow them to sleep. Some people will need just a short time to sleep, whereas others will need several hours. Ensure that the time of the seizure and medication given is recorded. The individual care plan will have details about usual recovery times. Sometimes you may have to deal with someone having a seizure in a public place. With a person with limited mobility, extra care should be taken. Call for help if needed. If the person has no head support on the chair, go behind the chair and gently tilt and support the head by holding the chin. Gently open their mouth by applying pressure on the lower lip. Administer as in the first demonstration. After administering the epistatus, support the head gently in this position until the seizure subsides. Find the person a place to rest as soon as possible. The need and procedure for administering rescue medication to a child is the same as for an adult. Again, individual care plans are essential, particularly with regard to dosage. So now, at the end of this DVD, you should know how to administer epistatus to prevent a seizure from progressing into status epilepticus. And finally, at all times, be familiar with the epileptic person's individual care plan.
Administration recap. Check the bottle for presence of crystals and expiry date. Unscrew the cap, keeping the bottle upright. Push the plunger of the applicator towards its tip. Insert the applicator into the center of the bung in the bottle's neck. Turn the bottle upside down. Pull the plunger back completely and push back to release any air bubbles. Pull the plunger back slowly again and draw up the prescribed amount of liquid. Upright the bottle before removing the applicator. Place the applicator into one buccal cavity. Slowly release half the liquid. Repeat with the other buccal cavity. Replace the cap to stop spillage and evaporation. If the person is difficult to control, place all the liquid into one cavity. Wait 5 minutes for the epistatus to work and the seizure to become less active. Check the person's breathing. Recovery should be in progress after 10 minutes. If not, call for an ambulance. Once the seizure has stopped, place the person into the recovery position and allow them to rest.